VascularAccesChild is a high-fidelity central venous access training solution specifically designed for pediatric training. Simulab designed this simulator by leveraging its highly acclaimed adult-size simulators, Central Line Man and Femoral Line Man, and then customizing it to meet the unique needs of pediatric vascular catheterization. This simulated 5-year-old is ultrasound compatible and has 3 access points: subclavian, internal jugular, and femoral. VascularAccesChild also includes 2 arterial pulse bulbs, which provide excellent simulations of the arterial pulse when palpated, and also when the pulsating artery is viewed under ultrasound. Both the neck and femoral tissues are equipped with a syringe, so that venous pressure can be adjusted, allowing the user to simulate low blood pressure complications. The simulator's tissues are replaceable and come pre-filled with 2 colors of simulated blood. Each tissue should last for approximately 50 to 100 full catheter insertions, or hundreds of needle sticks per access site. In addition, this trainer allows the user to practice real-time ultrasound guidance during catheter placement. Now let's take a closer look at the central venous procedure. Please note, this is for product demonstration only, and in no way represents medical training or curriculum. Similar to an actual patient during this procedure, VascularAccesChild is oriented with the head turned to the left, and all of the important landmarks are present for each site. The subclavian site includes the sternal notch, the first rib, and the clavicle. For the internal jugular site, the user will be able to locate the apex of the triangle formed by the 2 heads of the sternocleidomastoid, the clavicle, and the pulse of the carotid artery. For the last access site, the femoral vein, the landmarks include anterior superior iliac spine and the pubis symphysis. The user will be able to locate the pulse of the femoral artery and the inguinal ligament. When the needle enters the vessel, the user will receive a flashback of blue venous fluid. An ultrasound imaging unit can be incorporated into this procedure. Begin by turning up the gain on the ultrasound unit and applying gel to the tissue before proceeding. Search and find the vessels on the imaging unit. Notice the realistic appearance of the tissue, vessel walls, and contrasting fluid-filled vessels. Simulab has made continuous improvements to its tissues to create the most realistic simulator. VascularAccesChild is the only pediatric venous access trainer that responds to ultrasound, provides the most realistic soft tissue available, includes all necessary anatomical landmarks, includes arterial pulse and low venous pressure simulations, has 2 colors of simulated blood to differentiate a vein from an artery, has easy-to-refill simulated blood reservoirs,